The notion that we should just blindly take all of the Commission recommendations, I think, is a bad idea. And let me mention a couple of them. And have you been discussing some of these Commission recommendations? I'm sure you have. But here are some of the things that they would do. Number one, with respect to federal employee retirement, they would require federal employees to put in more on a regular basis, which of course amounts to a pay cut. And one thing that I think most of us recognize, and I hope the American people will begin to recognize more, is that when you look at federal employee pay, in fact, and these are not my statistics or your statistics, these are the statistics of the Bureau of Labor and Statistics, which has been keeping these statistics by the same methodology for years and years and years in Democratic administrations and Republican administrations. In fact, federal pay is significantly below their private sector counterparts. And that's because some of these more recent studies you've seen from groups like the Cato Institute. Cato Institute, of course, is an organization that doesn't believe in government, so it's not really surprising that they would reach some of the conclusions it did. But they don't take into account the levels of education. They don't compare like individuals in the public sector with like individuals with similar education and professional backgrounds in the private sector. And of course, if you're comparing apples to oranges, you get a very skewed result in the numbers. But the numbers that have been coming out in a uniform way from the Bureau of Labor Statistics over a period of time have been absolutely clear. Now, it is true that some of the benefit levels provided to federal employees are better than some of their private sector counterparts. That's partly as a result of the fact that the wages have been lower. But again, if you take the entire compensation package, it remains the case that public sector employees, federal government employees, are paid less than their private sector counterparts. And there's a very clear explanation for that, and I know that from my constituents and from my parents, which is that all of you make a decision to help contribute to your country through your work. I mean, what you do every day when you get up and go to work, or did get up to go to work when you were part of the federal government, was to help move our country forward. And as a result of doing what you thought was right, and what indeed was right for the country, that meant making some sacrifices when it comes to compensation. And I salute all of you for making that decision to put your country first. And what we need to do is make sure that as we continue this debate, that remains, that people understand the decisions that you made. So when the Commission says, well, we're going to reduce people's retirement, effectively reduce people's pay and compensation by requiring a greater contribution to the retirement plan, we have to point out that all you're doing is trying to balance the budget on the backs of folks who've been working very hard on behalf of our country. Another proposal that the Commission put forward would use the Federal Employee Health Benefit Plan as the guinea pig for turning the healthcare system into more of a voucher program. There are proposals that have been put forth by some of our colleagues to turn Medicare into a voucher program. What do I mean by that? Right now, Medicare is a guaranteed benefit program. Everybody puts in during their working days, and as a result, you're guaranteed to receive a certain amount of care through Medicare. Well, there's a proposal to say instead of having a guaranteed benefit under Medicare, what we're going to do instead is give everybody on Medicare a voucher worth a certain amount an amount which declines steadily over a period of time. So in fact, 75, it's gradual, so the idea is people won't notice what's happening. But by the end of this period, the way they save all the money is the value of that voucher declines by 75%. By 75% at a time when we know healthcare costs actually go up at a higher rate than inflation. So the idea is people on Medicare will get this voucher, they'll be thrown over to the insurance industry and told to go find a policy that will cover all their health care needs with a voucher that is worth much less than the value that the medical providers are currently reimbursed at. So the response is going to be pretty clear. You think it's tough to find, people already have some difficulty finding some doctors who will take Medicare in some places. But I'll tell you, when you cut the value of that voucher by 75%, it's going to be awfully difficult to find care provided. So what do I say when they're going to use the Federal Employee Health Benefit Plan as a guinea pig? The proposal that they put forward is, well, we're not going to jump right into that for Medicare, but we're going to start with the Federal Employee Health Benefit Plan. And for both current and retired employees, we're going to give you a voucher, and the value of that voucher will rise at a very small rate, much slower than the rate of medical inflation. And so under the current system, on average, the federal government contributes about 30%. I'm sorry, 70%. Employees cover 30% of health care. What will happen over a period of time is that will change significantly, and employees will be contributing a lot more than the 70%. And that obviously will result directly in reducing compensation, obviously, for federal employees. So there's a whole lot of stuff in that commission report that we should pay close attention to, and I know your team here is paying close attention to. But I'm glad that the President didn't rush to include a lot of the stuff in that commission report. We should look at all their ideas, a lot of their other ideas, and a lot of them are tough, and we're going to have to make some tough decisions. But as I said at the outset, we should not be making these decisions in a way that asks only all of you to make the sacrifice. And as all of you know, the President made the decision to freeze federal salaries for 2 years. None of us like it. None of us like it. But so long, in my view, as the President is going to ask for shared sacrifice in other parts of the budget, it's something that, while I don't like it, and I'm sure you don't like it, I think we're going to have to, that's a sacrifice that people have been prepared to make. But what people do not want to do is see that extended even more, see these changes made to retirement, see these changes made to health care systems, and see that only federal employees are being asked to sacrifice. That simply is not fair. And we need to make sure that as we go through this fight, we tell your story.